15 most dangerous foods for arthritis. The next time you sit at a dining table, resist the urge to reach for these dangerous foods. They are probably the cause of the joint pain, swelling, and stiffness you feel. The truth is, you won't feel any better until you stop eating them. More than 54 million Americans are affected by arthritis, and it has become the primary cause of disability in the United States. So if you have been diagnosed with arthritis or know someone who has it, you may want to watch this video to learn about the 15 dangerous foods for arthritis that many people often overlook. Making the correct food decisions can help manage your arthritis symptoms, lower your chance of suffering pain, enhance your general health, and enhance your quality of life. Avoiding foods high in purines, nightshades, added sugar, high salt, and in inflammatory fats are a few examples of how to do this. Let's take a look at these dangerous foods that you should absolutely not be eating, starting our list with number 1. Added sugars. It's common knowledge that older folks should reduce their sugar intake, and it is for a good reason. People with arthritis should stay away from sugary foods and sweets, as they are probably the worst foods for arthritis. But why is this so? Consuming a lot of sugar causes the body to become more inflammatory, which is the main sign of rheumatoid arthritis. The inflammation causes pressure on your joints, which in turn causes you pain. If you are wondering which added sugar foods to avoid, according to a scientific study involving 217 patients with the condition, the most likely foods to aggravate rheumatoid arthritis symptoms were found to be sweetened soda and sweets. Furthermore, a number of studies have shown that drinking sugar-filled beverages might considerably raise an older adult's chance of developing arthritis. Let us explain how that works. Consumption of sugars basically leads to weight gain, and when you gain this extra weight, your joints have to support it. That would be extra work and stress for your body, ultimately leading to arthritis. What are you waiting for? Call up your older friends and tell them to consume less sugar. Number 2. Gluten foods. Among the top 5 worst foods for arthritis is gluten, which is a class of structural proteins included in certain cereal grains like wheat, barley, rye, and maize. You may be able to slow the progression of arthritis symptoms by including gluten-free foods in your meal plan, as there have been studies linking gluten to increased inflammation in the body. But here is the trap you did not expect. There is also evidence that those who have celiac disease and immunological response to gluten have an increased risk of arthritis. Similarly, compared to the general population, those who currently have autoimmune disorders such as rheumatoid arthritis have a much increased risk of developing celiac disease. This emphasizes even more the connections between gluten, celiac disease, and arthritis. So why not avoid this dangerous food as much as you can? Keep gluten off your diet. It is important to note that further research is needed to validate this notion, so conclusions about the potential benefits of a gluten-free diet for arthritis symptoms are still a little bit premature. Number 3. Highly processed foods. Ultra-processed foods are among the worst foods for arthritis, since they frequently have high levels of added sugar, refined grains, preservatives, and other inflammatory chemicals that aggravate arthritis symptoms. Foods in this category include baked products, breakfast cereals, and fast food. You might also want to cut white bread off your shopping list. This is because white bread is highly processed, and the end product that we eat is just starch, which contains sugar. Studies indicate that a Western diet high and highly processed foods may raise an older adult's risk of developing arthritis because of the higher likelihood of obesity and inflammation, among other risk factors. Another factor could be developing insulin resistance in type 2 diabetes due to the high consumption of white bread and other processed foods. In a study involving 56 patients, eating more ultra-processed food was linked to an increased risk of heart disease, including higher levels of glycated hemoglobin HbA1c, a long-term indicator of blood sugar control. Therefore, eating processed food may make you less healthy overall and raise your chance of contracting other illnesses. So when shopping, go for natural foods like entire fruits and vegetables that the body can digest more readily. Number 4. Processed and red meats. Because red and proc meats can inflame the body, some research associates them with worsening symptoms of arthritis. You see, red meats are higher in fat, especially saturated fat, than white meats and plant-based proteins. Therefore, consuming this red meat would be linked to higher inflammatory levels, which may worsen arthritis symptoms and joint swelling. For example, diets heavy in red and processed meats frequently have elevated levels of homocysteine C reactive protein CRP and interleukin 6 Illinois 6, which function as indicators of inflammation in the body. On the flip side, plant-based diets have been shown to help elderly people with their arthritic symptoms, according to one study. Eating less red meat and more poultry, fish, lentils, or nuts was linked to decreased levels of inflammatory biomarkers. Number 5. Fatty foods. The Arthritis Foundation advises that because various types of fat are known to exacerbate inflammation in the body, older people with arthritis should limit their intake of all fatty meals when eaten in moderation. Omega-6 rich foods like vegetable oils are not harmful, but in high amounts they can be dangerous, so elderly ones should watch how much fatty foods they eat to effectively manage their arthritic symptoms. However, consuming more foods high in omega-3 fatty acids such as fish may lessen joint pain and symptoms of arthritis. At the same time, trans fats should be shunned at all costs to show how risky they are. They are unhealthy for even those who do not have rheumatoid arthritis, since they increase the chance of the illness by elevating cholesterol levels in the body. So in summary, you should know that while omega-6 is found in margarine, vegetable shortening, and cooking oils like corn and safflower, omega-3 is found in oily fish, oily nuts, and green vegetables. Maintaining a balance between these kinds of oils could help reduce the symptoms of arthritis. Here is a tip that could work to help optimize the ratio of omega-6 to omega-3. Increase your consumption of fatty fish while using olive oil as an example of an oil with low omega-6 FA content. Number 6. Alcohol. One drink that has been shown to worsen arthritis symptoms is alcohol. It is advised that those who have arthritis limit or abstain from drinking it. Is however true that red wine has an antioxidant called resveratrol, which may be good for you, but every kind of alcohol usage has disadvantages. After all, a number of studies have suggested a possible link between alcohol use and osteoarthritis and other associated disorders. Consuming alcohol at least once a week may increase your chances of coming down with osteoarthritis. Also, drinking alcohol raises the body's uric acid levels, which could worsen gout in females. A 2011 research revealed a connection between alcohol intake and the development of rheumatoid arthritis. In summary, it's advisable to avoid alcohol as much as possible. Number 7. Salty foods. There's some evidence suggesting a connection between high sodium intake and a higher risk of developing rheumatoid arthritis. A specific type of inflammatory arthritis. Rheumatoid arthritis is an autoimmune disease where the body's immune system attacks the joints, causing inflammation, pain, stiffness, and swelling. Some studies suggest that high salt intake might worsen this inflammation throughout the body, potentially increasing the risk of rheumatoid arthritis. It's important to remember that many factors contribute to rheumatoid arthritis, and salt intake might be just one influence. Genetics and other lifestyle choices also likely play a role. Here's a deeper look at what further research suggests. High salt intake might affect how cells function within the immune system, potentially influencing how they target joints. Salt can cause the body to retain water, which can lead to swelling and put extra pressure on joints, potentially worsening arthritis symptoms in people who already have it. Considering all this, while there isn't a definitive link between salt and causing arthritis, it's still advisable to limit your salt intake for overall health. This can benefit people with or without arthritis. Examples of salty foods are processed meats, canned soup, pizza, shrimp, and some cheeses. Number 8. Nightshades. The term nightshades describes a class of vegetables and foods that have solanine, a glycoalkaloid molecule that in large amounts can be poisonous to the body. Tomatoes, potatoes, eggplants, and peppers, all part of the nightshade family, have been under suspicion because they contain a compound called solanine. Solanine is toxic in large amounts, but fortunately it's found more in the leaves and stems that we don't typically eat. Green potatoes, however, are an exception and should be avoided due to their higher solanine content. The main concern is that solanine might trigger inflammation, a major factor in arthritis. However, research hasn't reached a definitive conclusion. Some studies suggest solanine may worsen gut problems, which could indirectly affect arthritis. Mention anti-inflammatory diet and nightshades. As per Arthritis Foundation, on the other hand, other studies haven't found a connection and even suggest some nightshades like purple potatoes might have anti-inflammatory properties. There's also the possibility of individual sensitivities. Some people with arthritis experience worsened symptoms after eating nightshades, but this may not be related to solanine at all. If you suspect nightshades might be affecting your arthritis, it's important to talk to your doctor or a registered dietitian. They can help you determine if an elimination diet focusing on nightshades for a few weeks might be beneficial. By slowly reintroducing these vegetables one by one, you might be able to identify any potential triggers specific to you. Number 9. Dairy. It may surprise You to see dairy on this list because it contains minerals like calcium and protein. However, dairy products contain casein, which is known to cause inflammation. Some people find that milk and other dairy products cause an inflammatory reaction, although this is not the case for everyone. If you can tolerate milk, it is an excellent source of vitamin D and calcium. Choose low or zero fat dairy products to reduce your risk of weight gain and unhealthy fats. Also, reducing your elderly loved ones' dairy consumption will help them reduce joint inflammation and pain significantly. Number 10, foods that are high in age simply means advanced glycation products. These dietary end products are molecules formed when sugars combine with proteins or lipids. Away from all the grammar, which you probably may not understand, ag occurs naturally in uncooked animal foods and are created under specific cooking procedures. Foods that are high in ages include high protein, high fat animal foods that are fried, roasted, grilled, seared or broiled, including bacon, pan-fried or grilled steak, roasted or fried poultry and broiled hot dogs, fries, American cheese, margarine and mayonnaise. We know that is a pretty hard list to avoid, but here's the thing: when ages accumulate in large numbers in your body, they can cause oxidative stress and inflammation. Oxidative stress and AG production can contribute to the progression of arthritis by accumulating in bones and joints. So what is the solution? Replacing high-age foods with healthy whole foods such as vegetables, fruits, legumes and seafood may help to lessen your overall age load. Number 11, sodas and sweetened drinks. Sodas and other sugar-filled drinks can dramatically raise your risk of developing arthritis. In a research involving 29 adults in their 20s and 30s, those who drank 5 or more fructose-sweetened beverages a week were 3 times more likely to suffer from arthritis than those who drank few or none at all. And the reason is pretty obvious: fructose-containing beverages may also raise uric acid levels, which aggravate gout. This is so because aspartame sugar and phosphoric acid found in sodas and other sweetened beverages can interfere with the body's absorption of calcium, which is essential for strong bones. This would lead to weak bones and joints, and if you keep up with the lifestyle, a probable diagnosis of arthritis. Number 12, coffee. The relationship between coffee and arthritis is a bit of a puzzle, with research not providing a completely clear picture. Here's a deeper dive into what we know so far. Coffee boasts antioxidants and other intriguing compounds that potentially offer relief from inflammation and safeguard cells from harm. In theory, this could be advantageous for certain forms of arthritis, like gout. Inflammation is a hallmark characteristic of arthritis, and if coffee can indeed tamp down inflammation, it might translate to some symptomatic relief. However, things get more intricate when we look at rheumatoid arthritis, RA. Some studies have hinted at a connection between high coffee intake and an increased risk of developing RA, particularly Ca-positive RA, a form where specific proteins show up in blood tests. However, other studies haven't been able to confirm this link, leaving some uncertainty. Adding another layer of complexity, some research points towards decaf coffee potentially even increasing the risk of RA. This could be due to the chemicals involved in the decaffeination process, but more investigation is needed to solidify this theory. While coffee might hold some benefits for specific type of arthritis, there's also a possibility of increased risk, especially with high consumption, or if you choose decaf. If you have arthritis and enjoy coffee, it's wise to discuss your coffee habits with your doctor. They can help you navigate the potential benefits and drawbacks in the context of your specific health and arthritis type. Remember, moderation is generally a good principle when it comes to coffee consumption. Number 13, canned and fried foods. There is no need to panic. You only need to avoid canned foods that are rich in salt or sugar. Not all of them. For instance, a lot of added sugar is typically included in fruit bottled in syrup, which may intensify